Can.
So I just say hi to you.
Can.
Yes, I do. Wait.
Do we just pass it on?
Oh, already. I already passed it to the coordinator.
We'll pass it.
Hai, selamat tengah hari semua kawan-kawan media. So hari ini saya ada press conference regarding vaccination rate di Sabah. Jadi the main title lah of this press statement is the Sabah is at the risk of another COVID-19 wave with high daily cases and still the champion of the slowest vaccination state. So Sabahans have really serious concerns about the COVID situation in Sabah, where the continuous high daily cases are registered coupled with extremely slow vaccination progress. This lethal combination is putting Sabah at risk of another COVID-19 wave that will bring devastating impact to the state's public healthcare system as well as its socio-economic recovery. So since last month, Sabah has been crying out for more vaccine supply, which has resulted in the temporary closure of a few vaccination centres, including ones in Sandakan. So with this, further delaying the already slow vaccination progress in the state. Even the appeal of Chief Minister and Deputy Chief Minister of Sabah themselves had openly appealed to Putrajaya to speed up the delivery vaccine in Sabah. So there are some statistics that I shared. So the first one will be, according to the statistic by Jabatan Kesihatan Negeri Sabah, 9.7% of the total population in Sabah have been fully vaccinated, completed their vaccination, and 15.5% of the total have received one dose of their vaccination. This is by far the worst performing state in terms of vaccinated rate in the country. So as for Sandakan, we are even worse in position as the district has only managed to achieve 8.3% and 13.9% of fully and partially vaccinated respectively as of 24th of July 2021. So with the combination of the slow progress in the high daily COVID-19 cases, there are 7,579 active cases in Sabah. And only in Hospital Duchess of Kent Sandakan, we have 521 COVID patients that are being treated. So last week, there was a new cluster that emerged from Hospital Duchess of Kent, resulted in at least 13 new infections, including 2 medical staff. This has already severely strained the already overloaded public healthcare facility. And all the specialist clinics at Hospital Duchess of Kent has to be temporarily closed from 26 July, affecting hundreds of non-COVID related patients. Hemodialysis patients that are receiving treatment in hospital are also affected as 19 patients were infected with COVID-19, highlighting frontliners and vulnerable groups are also being attacked by this virus. So last Friday, as much delay, our Chief Minister finally announced that there are more vaccines that are on the way to Sabah, which include 2.2 million doses, which is supposed to be delivered for the month of July and August, which is scheduled to arrive next month. But with this sufficient to prevent Sabah from experiencing another COVID-19 wave? For example, does the government has a mechanism to track the large numbers of illegals and undocumented and record their vaccination status after in Sabah? The Chief Minister also announced that 60% of Sabah's population will be vaccinated by October 2021. To achieve this 60% target by October, Sabah need to vaccinate another 1.965 million people between now and October using a 2-dose regime. We will need to administer a total of 3.93 million doses, which is on average 40,933 doses a day. Surely a lofty target when we are struggling with 30,000 doses a day in the past 1 week. So Sabah's vaccination registration remains the lowest in the country. In fact, based on JKJAV's figure, up till now, only 39.2% of the population here has registered for the vaccination, about half the national registration rate. I would like to point out that My Sejahtera app, in fact, is an obstacle in getting more people here in Sabah to be vaccinated, and strongly urge the federal government to do away with the My Sejahtera app appointment system for Sabah immediately. If they are sincere and committed in helping Sabah to achieve herd immunity by end of this year, there are 3 main reasons why My Sejahtera app is impeding people in Sabah to sign up for the immunization program. The My Sejahtera app appointment system is just too complex for our senior citizens to navigate. Our office has been receiving hundreds of SOS calls from the senior citizens since the early of the year, seeking for our help to assist them in registration for the immunization program. Many of our senior citizens here do have a smartphone. As such, it is do not have a smartphone, so it is extremely difficult and troublesome for them to register via the My Sejahtera app. Many rural areas and interior areas do not have a stable internet connection. Who can forget the oldie of Viviana when she needed to camp up on a tree to get internet connection for her online examination last year? So without the internet connectivity, how are people in Sabah able to sign up for the immunization program through the app? The presence of a large number of immigrants and undocumented persons in the state are also very reluctant to come forward due to the inherent fear of the authority. So as such, it is crucial that the government has a complete mechanism or even our own version of Operation Surge Capacity, OSC, to urgently and immediately address the critical issues faced by the state in our fight against the COVID-19 pandemic. We are racing against time to get the population here in Sabah vaccinated to prevent another COVID-19 wave. Therefore, I would like to propose the following measures to speed up vaccination progress in the state. The supply of vaccine in Sabah must not be based on the total number of eligible population and not to be based on the total number registered for peak. We must introduce walk-in vaccination for those aged 60 and above in order to protect this vulnerable group. For those aged 60, no point opening up registration for those 12 to 17 years old, when we have so many senior citizens still not vaccinated when their they were trying to get the appointment since February and March. So we must also mobilize and deploy mobile vaccination teams to kampongs and estates to the state to start vaccinating the rural area population without waiting for them to register or queuing according to the respective age groups. A vaccination first, register later approach is one way to help Sabah if we still harbor any of achieving herd immunity by end of the year. So we urge the government to look into this matter where according to our demographic, My Sejahtera app, it is not as efficient and effective as other states. So in order for us to ramp up the vaccination registration level and also vaccination rate, we have to definitely use another method, which is walk-in vaccination. So that is the end of my statement. So is there any question from the friends online, media friends online? Yes. Yes, up till now we are trying to push untuk walk in, tetapi still in Sandakan district we are very disciplined lah. We are trying to the KKM in Sandakan is trying to still follow the My Sejahtera appointments, and because the low vaccination supply end of last month, kami punya a lot of the temu janji was rescheduled. So a lot of our old folks, they actually print screen their temu janji, and they say, okay, I circle the calendar, make sure I go to the vaccination center on this day and this time. So suddenly, when the vaccination supply goes low and they are unable to access the MySejahtera because it was print screen, and they show me, you see, I got my appointment via WhatsApp. Then I check, actually, your vaccination date has been changed because of the low vaccine supply. So that's why they are very confused and very angry, and sometimes they have to wait for message and then telephone calls. So which is a very difficult thing, adding more difficulty to the senior citizens or with the vulnerable group, which is OKU, that is now facing. So that's why our Hospital Duchess of Kent now is actually really packed with COVID patients, and there are not enough manpower. They are trying to do their best. So what we can do to help them is actually to ramp up the vaccination rate. Let us do walk-in, have a different system instead of just using MySejahtera, which is proven to be, for me, is a failed registration way method, especially in rural area. In Sandakan, not as rural, but I do have a lot of pulau-pulau, which is the internet connectivity is quite bad also. So dalam masalah dari sini lah. And then there's a lot of cases where dia punya temu janji, cannot find in the book or in the Google form, so they were asked to go back. And because of the PKP, it is more difficult for them to travel to go to the PPV center in Sandakan. So I want to urge government to have a more proper registration method, or just let them do walk-in. If they are able to get, a slot for that, just let them walk in and get vaccinated. And also mobilize the team to go to taman-taman, to go to kampung-kampung and get the people vaccinated. Sometimes you cannot just imagine, probably they belum tahu apa, what is the vaccination, they don't even have the idea of getting a vaccine. How do they do about it? There's so many cases that we went to the old folks' house, in the apartment. We went to their house and knocked on the door. Oh, they said that they don't even know how to register. There are still cases like that because they have no access to the media. So we have to mobilize more people, and then walk-in registry. Without the MySejahtera, it definitely will boost the vaccination rate in Sabah. Any other question? And I also would like to add on the 3 million doses of the new vaccine, the one-dose vaccine. What's the name of the vaccine? The new vaccine that they say that's going to give Sabah the one.
Johnson.
Huh?
Johnson.
No, Johnson. Sabah, is it? There's I have to check. There's also, I just saw that Ketua Menteri of Sabah, they said that we will be prioritized in getting the new vaccine, the one-dose vaccine for illegal immigrants, and also for the parti lah, we call them, that is menetap di Sandakan or Sabah lah. So actually, I do not know how many people, how many of this group of people, how large are they? We do know that they stay with us in our kawasan, but we cannot identify. And how confident is the government to say that they will come out to take the vaccine? Because apabila mereka keluar, takut kena hantar balik ke mana, we tangkap me or not. So things like that, there is not even a data. So the government has to come with a very clear way. How do you want to get this group vaccinated? Otherwise, Sandakan or Sabah will not reach herd immunity in any time soon. Not even October or coming year. That is one of the very biggest difficulties, apart from getting our own citizens to vaccinated, but also the penghuni in Sabah vaccinated as well. Yeah. Thank you. Any other question? From the online? Oh. Somebody asked to unmute. Is it? No, kan? Okay. All right. Thank you so much. If you have any questions, you can still ask me via WhatsApp also. Thank you.
Thank you.